Hello, viewers, and welcome to your health talk with me, Dr. Isatu Kakay-Diallo from Sierra Network Discoveries. I hope we all had the opportunity to take a look at the hypertension video, the stroke video, and today, where we left off, we were going to talk about, traumatic brain injury. So as we know, we already discussed the different lobes of traumatic brain injuries, what each lobe represents, what they're going to do for us. And today we want to elaborate more as to when you have an injury, whether it's related to an accident, whether related to a fall, or some form of trauma that causes for you to have a brain injury. So we want to discuss traumatic brain injury, or TBI, and concussion. So first, let's just see what the CDC defines traumatic brain injury as. According to the CDC, traumatic brain injury is a disruption in the normal function of the brain that can be caused by a bump, a blow, a jolt to the head, or a penetration of an injury that can cause you to have either a bleeding or a rupture of blood vessels within the brain cavity. Everyone is at risk for traumatic brain injury, especially children and older adults. Why do we say children? Children play throughout the day. They don't consider the fact that this might cause me to have an injury or not. While adults, as they get older, or the older adult we're talking about, above 60, they're on multiple medications. Some of them, they have poor vision. Sometimes that could be the reason for them having an injury, because medication side effects can tend to lead to, for you to have dizziness, low blood sugar, depending if the person have diabetes, if they're taking insulin and things like that. Infection, different things can lead to traumatic brain injury. So some of the data statistics shows that 28% of traumatic brain injury are due to fall, while 20% are due to traffic accidents. That's a huge number. So when we talk about fall, it makes us wonder, how do we prevent the elderly from falling, or anyone whatsoever from hitting their head? Because if you hit your head, you don't really know what's going on within the brain until they do an imaging, which we're going to talk about a little more as we go down, in this topic or discussion today. And then 19% of people that have traumatic brain injury, this is from the data, by the CDC, in 2014, there were approximately 2.5 million traumatic brain injury that were related to emergency room visits in the United States, not to talk about the world, right? This is just the US. And then over 812,000 were children. And that's why we said children are at higher risk for traumatic brain injury as well. And out of that number, you had 56,800 deaths in that number that accounted for traumatic brain injury, as well as 2,529 deaths were children that died because of traumatic brain injury. So intentional self-harm, unintentional falls, and motor vehicle crashes were the most common mechanisms of injury contributing to a traumatic brain injury related deaths. And then 11% are due to assault, while 7% may be due to other causes, and then around 9% were unknown. Then you have suicide, which is about 1%, and other transport or bicycle, you have 3%, and then 2%. So More than 90% of injury-related deaths occurred in low-income and middle-income countries. Why? There are different things that can be put in place in order for people to understand that they need to stay protected by wearing helmets, by protecting themselves from getting injury to the head. So traumatic brain injury is something that we can prevent as a nation. For example, my country, Sierra Leone, people ride okadas, what they call the motorcycles is what they call okada for means of transportation. But you see that some will wear the helmet while others don't. Even the passengers sometimes do not wear the helmet because they find it as if it's a casual ride, but it's really not. If you prefer to use a helmet, your best option is to wear a helmet so that you could protect your brain. So the last time I was in Sierra Leone, we did a survey for traumatic brain injury. About 69% of injury, head injury, were related to people that ride the okadas or the motorcycles. Accident victims, they had large numbers. So there's more studies and more research that needs to be done. And that's why we talk about, a program that we at Sierra Network are working on called NAPHITS, which is a national alliance, in preventing head injury and trauma in Sierra Leone. So it's something we're working on, and we really want government, and the Ministry of Health to put strict measures in place for those people riding okada or motorcycles for means of transportation. So part of the human brain entails the frontal lobe, the parietal lobe, the occipital lobe, the cerebellum, the spinal cord, and the temporal lobe. All these different lobes have functions that they present with, things that we can do. It coordinates that and transmit those messages, give us the opportunity or help us in how we do our day-to-day activities. But if any of these lobes are affected, it affects our movement, it affects our speech, it affects our vision, it also affects breathing and everything that you are doing. Your brain controls that. Your brain is within the skull where you have, blood vessels, that if ruptured can lead to different things that we have talked about, things like stroke, for example. Functions of the brain. The brain controls our thoughts, our memory, and our speech, as well as movements of the arms, the legs, and the function of many other organs within the body. And then our nervous system is composed of the brain and the spinal cord. And the spinal cord is a long bundle of nerve fibers and cells that extends from the lower portion of the brain to the lower back. So as you can see, these two organs in our body have to work hand in hand to transmit messages. Then you talk about what does the spinal cord does. The spinal cord carries signals between the brain and the rest of the body. It carries signals from the brain that controls our movement and our autonomic functions. By carrying information to the brain, the spinal cord nerves also transmit messages to the brain from the body, such as sensation of touch, your pressure, and pain. Reflex responses. The spinal cord may also act independently of the brain in conducting motor reflexes. Symptoms of traumatic brain injury, as that's our main topic today. We just wanted to throw light on some of the functions of traumatic brain injury. Traumatic brain injury can have a wide range of physical and psychological effects on someone. Some signs and symptoms may appear immediately or after traumatic event, while others may appear days or weeks later. Physical symptoms could include loss of consciousness for a few seconds to few minutes, no loss of consciousness but a state of being dazed, confused, or disoriented is possible, headache, nausea or vomiting, fatigue, drowsiness, feeling sleepy, more than usual, or loss of balance. Some of the sensory symptoms would include blurry vision, ringing in the ears, a bad taste in the mouth, or changes in the ability to smell, sensitivity to light or sound, cognitive or mental symptoms that would include your memory, your concentration, your mood might change and mood swings might occur, and feeling depressed or anxious for somebody that's experiencing a mild form of traumatic brain injury. Then you go into the symptoms of moderate to severe. It will include everything what we just discussed about mild. In addition, the appearance is just going to be from it's going to last for hours to days compared to the one that would last for few seconds to few minutes. So that's the difference and the severity as to how these symptoms going to continue when you sustain a traumatic brain injury. So sometimes patient may have repeated vomiting. The patient may have repeated vomiting. They may have convulsion or seizures. They may have dilated pupils, for either one or both of the pupils. They may have clear fluid draining from their ears or their nose. They may have inability to be waking up from sleep, weakness or numbness in the fingers and toes, and loss of coordination are all symptoms of traumatic brain injury in a moderate to severe form. Then you talk about the cognitive or mental symptoms. That would include a profound confusion. So now this person that you used to speak to, they can communicate with you with no issues. They communicate with you with no issues. But then now what are they doing? They're having agitation, combativeness, or other unusual behaviors. Slurred speech is going to be possible. Slurred speech is possible with the traumatic brain injury, as well as coma or other disorders of consciousness is possible. Children may have persistent crying. So these children may have the inability to pay attention. They may sleep. Their sleeping habit will also be affected. They might be sad, depressed mood, loss of interest in doing activities that they normally would do with no problem. Headache might be also prominent in the children depending on their age. So traumatic brain injury has a lot of effects on both adults and children. Traumatic brain injury, as I was saying, how do we diagnose these things? First, the question about the circumstance as to how the injury occurred is important. Assessment of the person's level of consciousness and confusion. Performing a neurological exam to assess the patient's or the person's memory and thinking, their vision, their hearing, their touch, balance, reflexes, and other indicators for brain function. Depending on the nature of traumatic brain injury and the severity of the symptoms, traumatic brain injury imaging is required, like computer tomography or computed tomography, which is called CT scan, or an MRI might be needed for these patients to determine the degree of the injury, whether there is a bleeding swelling within the brain or the skull. Because as you think of your brain, it's already closed, beside the spinal cord that is attached to it. And then if you continue to get swelling within the brain cavity, what will happen? What will happen is you're not going to have room. You're not going to have room. It's going to now cause for the patient to have or exhibit all the different symptoms that we have talked about. Also leading to for them to be confused, for them not to be themselves anymore. Treatment and management for traumatic brain injury after diagnosis will include diuretics, anti-seizure medication, coma-induced drugs. In some cases, if there's hematoma, meaning blood clot within or blood clot within the brain cells, they would need to have a surgery. That depends on what was noted on the CT scan or the MRI. Repairing the skull fractures might be needed. Opening a window within the skull in order for the swelling to decrease is important. That's the medical management part. And then you're talking about, after all that, you're talking about rehabilitation. Occupational therapist, physical therapist, speech and language pathologist, neuropsychologist, recreational therapist, and vocational counselors. Concussion, which is a type of traumatic brain injury, or TBI, is also caused by a bump, like people that play soccer or football, the American football. You see how they have to wear helmets? These people sometimes do sustain traumatic brain injury in a mild form that they call concussion, and it is a sudden movement that can cause the brain to bounce around and twist within the skull, creating chemical changes in the brain and sometimes stretching and damaging brain cells. So these are things that can also happen when somebody sustains traumatic brain injury or concussion. Medical providers may describe a concussion as a mild brain injury because concussions are usually not life-threatening. Even so, the effects of concussion can be serious. Some of the things that we see with concussion, it's graded. Grade 1 would be if the confusion lasts less than 15 minutes. Grade 2, confusion and amnesia lasting more than 15 minutes. While grade 3, there's a brief unconsciousness or more serious amnesia, meaning forgetting things, right? So there's different types. As you can see, there's a coup and counter coup injury, meaning the primary point of impact where you hit your head, then the brain bouncing back to the opposite direction of the brain is why they call it counter coup. That's the secondary impact point. And then symptoms are similar to the mild form of traumatic brain injury, the headaches, the nausea, the vomiting, problem with your balance, you become dizzy, there's blurry vision, and feeling dazed and froggy. All these things can happen with somebody with traumatic brain injury. Then the danger signs. When you talk about traumatic brain injury, danger signs to look out for: pupils are dilated, meaning one of the pupils are larger than the other. The headaches that does not get better even when you try all different modalities or treatment measures can lead to, things to consider, to say, this is dangerous. So what can we do now, right? So as we were talking about the danger signs of traumatic brain injury, you are concerned about dilated pupils. You are concerned about somebody being drowsy. You cannot awake them from sleep. The headache they have, it's so persistent. Despite of all treatment modalities or measures, the headache is still there. and the person continues to experience slurred speech, weakness, numbness, or drowsiness, and decrease in their coordination, that would concern you as to these are danger signs of traumatic brain injury. They may start exhibiting unusual behavior, increased confusion, restlessness, and agitation are all things that you worry about when somebody sustains a head injury or traumatic brain injury. And then also these patients that are having traumatic brain injury will have, loss of consciousness, and especially that moment when they were just injured. It can be even a brief loss of consciousness that should be taken very seriously. Even if the person has brief loss of consciousness, you take that very seriously. Then we talk about the children, the infants. They will continue to cry because if a parent have a baby or a child that fell, due to an accident, or they've been shaking the baby vigorously, then they don't know that you shouldn't be shaking the baby. That's a different topic on infant, but it's a form of traumatic brain injury, because shaking the baby because they are crying, you don't even know why they're crying. You keep shaking them with the thoughts that, you're going to console them. But in doing so, you will cause them to have an head injury. So things like that can be a concern. To a parent, the child is crying, they don't want to eat like they used to eat. So that should concern a parent, and they should seek medical help as well. So the bleeding, the swelling within the brain are all signs of traumatic brain injury, and really are things that needs immediate medical interventions. Then you talk about effects of traumatic brain injury. You talk about the physical, behavioral, and cognitive aspects of traumatic brain injury that are concerning. You're talking about sleep disturbances, pain, especially headache, changes in the sense, those are physical, loss of motor skills, digestion changes, being fatigue, coordination and balance, with impairment. And then the cognitive, they will keep repeating things, forgetting things, trouble paying attention, impaired orientation to person. They don't know themselves sometimes. They don't even know where they are. They don't know what time it is. So that concerns you when you know somebody who's oriented, they were talking to you fine, they didn't have no problem, and now all of a sudden they don't understand, they don't know who you are, they keep giving you a different name or calling you a different name, and then you wonder, why would this person act like this? So when things like that happen, you, the person they are with, should really take them to the nearest medical hospital to be evaluated. Sometimes they have difficulty with communication and processing things, while behavioral issues would include the mood swing, the personality changes, the anxiety, depression, their temper, the anger. All these different things can happen, and sometimes changes in their social skills. And flat or restricted affects, meaning the way they look, it's not the same for them. Those are some of the behavioral changes. So the key theme here, or the take-home message for us to take a look at or to focus on, if you have a healthy brain, you'll be able to perform your daily life with no problem. But if any of the lobes that we started with, meaning the frontal lobe, get affected, then it affects what you do on a daily basis. So your frontal lobe, which is responsible for your concentration, problem solving, and speech, if there's a traumatic brain injury or TBI, there will be lack of focus, irritability, language difficulty. And your parietal lobe, that is responsible for your sense of touch, pain, and temperature, when there is an injury to that part of the brain, you're dealing with difficulty with reading, spatial misperception. And then you talk about your occipital lobe. Healthy vision is part of the function that the occipital lobe or deal with. And then if there's an issue or there's an injury with that, then you're dealing with issues of blurry vision, blind spots. And then you're talking about your temporal lobe that deal with your memory, your organization. Now there's an injury to the temporal lobe. You're talking about problems with short and long-term memory. And then cerebellum that deals with our balance, our coordination. If there's an injury to that area of the body or the brain, then there is a difficulty in walking and causing slurred speech as well. Then you deal with your brain stem, which is the way bottom part of the brain that is connected to the spinal cord. If there's an injury there, you're dealing with which it controls our breathing, it controls, our heart rate, right? So if somebody experiences injury to that location, what they can experience now is breathing problems or changes in their breathing, difficulty swallowing, are all being controlled by the brain stem. And now with injury, these are the things that you would experience. And then again, our danger signs to look out for that needs immediate medical attention. It would include, if you see somebody is drowsy, they have different sized pupils, they have seizures, they have trouble recognizing people or places, they become confused, restless, and agitated, they presenting with unusual behavior and loss of consciousness. It's a call for concern. And how can we prevent things like this? Helmet or appropriate headgear when the person, the child, whoever is riding the motorcycle, the bike, the bicycle, playing the soccer, the football. Soccer is, football in Sierra Leone, but sometimes the soccer players do hit the ball with their head, right? And depending on the gravity of that force, it can has its own impact on that soccer player or football player in Sierra Leone. Because in Africa they say football. So, but the American football here, you see they're wearing the helmet because the way the sport is being played, right? And also other things you can do to prevent injury. Wearing your seatbelt when you're in the car, right? Don't text when you're driving, because these are things that all can distract you on the road. And also if you have a baby or a child, an infant, they need to be in a car seat. And the older children should be in a booster seat. And then try not to drive while you are under the influence of alcohol or drugs. So in doing so, we can protect our brain, and also we can get a stronger future. So that's the guidelines the CDC follows, what they call heads up. So that's heads up focuses on safe brain, stronger future. Something for all clinicians or healthcare providers should look out for is to assess, counsel the person or the patient, refer them to the appropriate specialty for treatment, and also if these are young children in school, they should be provided with a letter as to what are the indications for them to look out for if they start experiencing any of the danger signs, for the school authorities or the school teacher who's with the child to be looking at, so that they can identify the problem and the patient or the child should be sent back to the medical facility for further evaluation. So going into the topic now, I'll briefly talk about traumatic brain injury in my local dialect, Creole, because as I talk about this, I talk about NAPHITS, which is the National Alliance to Prevent Head Injury and Trauma in Sierra Leone. So we will end the segment from the English language to Creole. So Miss Halon Fambudem, this is not Dr. Isatu again. I've been to talk to everybody about traumatic brain injury, which is not traumatic brain injury. This is not something where it be say if you fall down, for example, where you fall down, or you get motor you get accidents because of, na motor car or na okada they ride, or na bicycle they ride, and you know wear helmet, then you hit your head. Wetin can end up for happen? The person, they get problem with the brain, either the vessels then within our brain, they bleed. When it bleed, it become swelling, meaning the water they settle within the brain, right? Because inside we brain we get fluid or water, a form of clear fluid when our water, but na part of the body. It go from the brain to the spinal cord, when are the spine, the one where they take message from inside the brain, it carry go na the other side of the body then. So if you get injury or you fall down, you hurt yourself, you not go see the doctor, wetin get for happen? You dey begin dey get symptoms them where, for example, it go happen, if na the mild form, meaning this not happen for too long, it can just be, say you get headache, you feel like say you want vomit, and sometimes and they not able to sleep well, and like where they waka, you not able to waka fine, and the person self where they near you, therefore begin they recognize the way you talk to them, you talk not make sense. So if that they happen, that person waiting next to you for really make sure say then take you na hospital, so then go evaluate you or then will check you for say really wetin they go on with you, why make this they happen to this person, or not because if you don't get okada accident, or not because if fall down from a tree or if fall down from a high area. So then thing and the way it happen, Lord look at them, because somebody will be they talk to you fine, get no problem. But now what you don't begin to see, they even make sense to you again. So then thing and they for be a concerning something to you. For say, you know what, this then don't happen to this person. So, I need for Karango, they need for check them out. Maybe you need for do a scan, not to x-ray no more, now a different form of x-ray where they check the brain for see if the person now bleeding, if not blood or not swelling, and then the brain where be say, you don't fall down or you don't get motorcycle accident or Okada accident. So now make it important, we will elect for ride the Okada riders them. Or we will elect for ride Okada to start with. The Okada rider will wear your own helmet, but you self for wearing your own helmet. Because when you do that, you will protect your brain, you will get a brighter future. Because sometimes when people then get traumatic brain injury or brain injury, then they give them medication. But in some cases, then the medication alone not be enough. So then get for do surgery, if you have blood, now instead under the brain, for let them remove them, what then they call hematomas, right? And then when they do again, you get for go through rehab, you get for do therapy, you get for get possible for teach you how to talk. All that thing and they go to happen. So now make where they ride Okada, and for wear your helmet. Yeah, you where they ride the Okada and the Okada man self for wearing helmets. I know say now the easiest way down there for law get around town, a free town or na salon as a whole, but we get for think about and say, what you go do to me? Why I get accident? What I go do? Because remember your family member they need you. Maybe now you know the one where they come out, you go look for money, for can't take care of you, loved ones them. So if you know they, it will really cause a lot of problems in your family. So yeah, law take them very seriously. Law wear we helmet. We when they drive motor car, law put a seat belt there on. Law make sure say we know they text and we they drive, because all that then they become distracting to you. But the key thing there so we I want let everybody pay attention to, for say there were a danger sign them. The moment I see say somebody don't begin the experience, I for call the nearest medical authority number we'll get in the country, and then or take the person to hospital and go check them out. So if the person they feel like say it sleep, they even like they talk to her, just they feel sleepy, and then they try for waka, imbalance in waka not balance, right? So the way the waka not make sense, the waka street, it stumble, it didn't ask, so they go back and forth. Then thing what they call fix when are seizures. maybe you don't begin get seizures. No take and say na devil, no to devil. Yeah, that not to devil. When you get interruption at the brain, the chemicals there or the fluid there waiting at the brain, it mix up. When it mix up, then it cause all them different things there. So not take and say na devil, now for take the person in hospital one time. And then also, they begin to see say the person eye, the black part na the eye, no, it not equal. One big, one small. Then they for be concerning to you. Sometimes they say now all two. Now you go begin see say it don't be so big, it don't fix. You know they even move. If you shine light there, you know they even go down because technically, like right now, if you shine light na me eye, the black part, where the inside it becomes small. And then they call with pupils, it react to the light, right? But the one them way not can react, you don't see problem there within the brain. This person they become confused. What did you talk to? Make sense. It call you other name self, So then they for make you concerned. They will begin to vex for nothing. They just they vex by you for something where you don't even know why make then they vex. So then has something we for me call for concern. So as we end today's topic, dear, if you not possibly drink alcohol, where they do drugs, not drive where they do the anything and they make louder person drive you. Make sure say you wear your helmet. Make sure say you talk to people there. You self we don't listen to this topic today. No left an hour, not for sharing, not for talk to the other one them. Say what in. And so for do if somebody for them, you just sit down and say, na for them, no for them, the picking down for them, no left hand day. When you left hand day, for take an hospital, let them check them. Let the doctor tell you, say, okay, everything look okay, but if this happen, and for bring them back. Now we roll down there as caregivers or people them, mama them, papa them, brothers, their auntie them, when they take care of picking them. Dear picking or you loved one, anybody where they next to you, you experience any of them thing and they not sit down there. Do not sit down near a more now for take a like and go hospital. So I want to say again, thank you for they listen to this topic, and this is not something we'll go to try for the do every Monday, and una for the like the program, una share the program, una talk, because when you share something, because you don't learn, the other person self don't learn because you share the information, right? So something where you not be know, you don't know today, now for sharing. And now for the comments, and if something there where you want to talk about next, let know. We will talk about that day. So I switch back to English. So to my listeners, to the viewers, please don't forget to share. Don't forget to comment. Don't forget to subscribe. These are things that we want to discuss as we can try on a daily basis in how we can manage our health. Because every little information that you learn today, you sharing it will help somebody else to, learn in how they can take care of themselves. So please share, comment, like, and hit the notification bell so that until we meet again on the next health talk, this again is Dr. Isatu Kakay-Diallo, family nurse practitioner. Thank you.